This is my first year as Chief Executive of the Mental Health Network, and so this is my first conference, so I'm pretty excited about it, and I'm pretty excited about the buzz that's around amongst leaders in our mental health sector about attending the conference, getting lots of good feedback and hearing about lots of people who are coming. And we've got a number of our members right across the sector who are contributing to the specific mental health network sessions that we're doing. It's been a really tricky year, I think, for particularly leaders in the NHS. And I think this will be a great opportunity for people to get together, and as always, as somebody who's attended many of these conferences, they're always great value, and the networking is always one of the most important aspects of it. So I'm looking forward to meeting lots of members and being there, doing that networking, and all those drinks that people are offering to buy me, I'll be picking them up when I see you there. On the first day, on Wednesday, we've got two key sessions for Mental Health Network members and others if they want to sign up for them too. The first being about the movement that we've seen in our sector with many mental health providers taking on out-of-hospital and community services. This is something which we've been surveying over recent weeks to find out what's happening, and this will be the first time that there's any serious attempt to start to develop a narrative around this and to report back on some of the kind of key important things that have been emerging as a result of that market change. So we've got some great speakers who are going to talk about not only highlighting good practice, but also some of the governance issues that have emerged from that, and also some of the context that will emerge from the surveys that we've been doing. So we've got that first of all, and also on the Wednesday we've got a really important session around recovery and the IMROC movement. Together with the Centre for Mental Health, the Mental Health Network has been in the forefront of this, and members have adopted it in large numbers, and we want to report back on that and talk about some of the outcomes and some of the context around that too. So look forward to seeing people there, and I would suggest that you really need to sign up early, because some of these sessions in the past have been standing room only, so it'd be really good if you get signed in early. Then on Thursday we've got a really interesting session. We're well and truly in the digital age, aren't we? And I'm sure all our leadership out there is well and truly in the digital age. Well, what impact is that having for service users, for patients, and indeed for organisations in the way in which they think about the future? What products are on the market? What do we do about quality assurance, etc. We've been doing some work on this, which has been sponsored, and we've been working with a number of other partners around this and gathering information not only nationally but internationally too. So there's a session on the tech revolution and what difference does all that make to us, and I'm sure that will be of great interest to a number of people who are attending. And then last but not least, and arguably the most important, is that we've got a session on safety, which is on Friday, on the last day, when we'll be getting a number of speakers who will be contributing and talking about issues around safety. This is at the top of, I know, all our members' agendas, and I think this will be one that will be well worth attending. Just as a final note as well, can I just remind people that on Thursday we've got our AGM, and I'll be really looking forward to meeting everybody at our AGM and catching up with people there too.